Hey, Christy!
What?
Wrong video, it's not TikTok.
Is that?
No, we're recording for YouTube, remember?
Oh. Okay, hold on. So, where should I begin? No, really. Where should I begin? Should I go over there? Oops, wrong audience. I'll be back. Does your medicine cabinet look like this? Are you finding yourself using so many different products because a friend recommended it or you saw it on social media? So now you find yourself using a cajillion different products. Is cajillion a word? Is that a word? So you're using all these different products and you don't know if it's even working for your skin or you're seeing little to no results. Well, that medicine cabinet that you just saw up there, that is actually one of my online consultations. And his name is Mahmoud, and he is actually from the Middle East. So meet Mahmoud. He is in his 20s, he's a civil engineer, and so he spends almost every day out in the sun for at least 2 to 3 hours. And he came to me for an online consultation. And usually what I do in my online consultation is I look at all the products, whoever I'm doing a consultation with, what they're using. So as you can see, he's using all different types of products, and it ranged everything from Drunk Elephant all the way to random products on Amazon. When I asked him, where is he getting all these ideas of using all these different products? And he said, well, social media and on YouTube.
I love this stuff. It's so good. It's $1.88. It's definitely going in the bin, and I will not be going anywhere near it ever again. And I will just stick to what I do around my eyes, and I will not veer from that because that works really, really well. I'm just going to stick with that. But no, A313 cream for me didn't work for me.
First step is just some sardine oil. Just get a generous amount all over your kitty paws. Oh, smells good. Just gonna put some of that in my hair. There's really no more effective way.
So that would include me, because that's how he found me. So the reason why he contacted me is because I have no idea why. He had some breakouts on his nose, as you can see in his photos. He also had some occasional breakouts. He had unbalanced skin because sometimes he had oily skin. And other times there were some areas that could be dry. And when I did further investigation, he actually had some concerns in regards to his post-inflammatory hyperpigmentation, which is, as you can see in the pictures, the reddish brown scars that you get after breakouts, but also the uneven skin texture due to his acne scars. And those are usually referred to as ice pick marks or pock marks. First of all, he wanted to know what product he could use for that. And so for those of you who are on here listening in, there is no product that you can use that actually smooths out deep acne scars, ice picks, or pock marks. Those you're going to have to do with microdermabrasion. Sometimes they do a combination depending on your skin, a combination of microdermabrasion and some peels with that. So that can help with the lightening, but it can also really help with the evening out the skin texture. Now, he cringed when he heard this because he did mention that it was so painful for him. And he had done a series of microdermabrasions. So he came to me because he wasn't quite sure what skincare products that he should use and if he was even doing it correctly, because he had some leave-on exfoliants. He also had some different toners. He also had some snail mucus kind of products, that type of thing, to help with his skin. So we're going to talk to you about what we did for the solution to help him with his skincare regimen. So one of the things that a lot of people don't think about when they're choosing skincare products is pH. pH. So one of the things that a lot of people don't think about when they're choosing skincare is the P and H. So pH. pH stands for the potential of hydrogen. And if you're looking at a pH scale, let's say I'm standing in the middle of the pH scale. So I would be considered a 7, which is neutral on the pH scale. Anything lower than 7 is considered acidic, and anything higher than 7 is considered alkaline. And our skin Typically the range, the normally accepted pH is usually around 5.5, or the range is 4.5 to 5.5. However, there has been some studies that have been done where they actually tested the pH of several different people with no products on their face first thing in the morning to see what the most average or the most common pH was. Hi, my name is Christy and I have been treating clients with acne, hyperpigmentation for over 12 years. And if you think that pH is not important, then ask a pool cleaner who is trying to maintain the pH of your pool. If it's just even a little bit off, you can grow algae. Ask a doctor who is trying to figure out the pH of the blood of the patient. Ask someone like me, hey, if you have acne, working with different skincare. So even though the pH ranges from 4.5 to 5.5, and it doesn't sound really big, on a pH scale, just even a little bit, a fraction of a point, actually makes a huge difference. So little babies, infants, we're talking 2 weeks or younger, and even preemies, their pH usually hovers around 6.5. So it's not as acidic, and that's why their skin is more sensitive. Once they are past that, from child all the way up to adult, just under 70 years, the pH usually is pretty stable. Now once you get up to 70 years and above, the average pH for that skin goes back up again to about 6.5. Men and women are a little bit different. So men, they clock in at about 5.8, and for women it's usually around 5.54. So why does this even matter? Because one of it is water. So when you're washing your hands with water or you're using skincare products, some of you are in areas where the water is too hard. So it's very high in lime or minerals, and that makes the water more alkaline. So it can strip the acid mantle from your skin. If the water is really hard and you're using acidic products, depending on the acidity of the cleanser and how hard the water is, it could neutralize the acidity. And another one is if you're using soft water, one of the ways that you can tell that you're using soft water, well, usually you would know if you're using it, is when you're washing your hands and you rinse off, it will still feel kind of slippery and smooth, and it'll feel like you still have the cleanser on your face, and that's actually how you want to feel. Okay, so the reason why your skincare may not be working for you or you're not getting the maximum results is because they actually did a study, a random study of 425 different products, and out of that, excluding sunscreen and hair products. So out of this random study of the 425 products that they tested, only 8 of them, so this is 8 products here, 8 of them actually tested at 4.5, and out of that, only 2 were actually 3.5 to 4.0, and those were the AHA based products. So as you can see here, there's a lot of factors that go into it. So even though I had mentioned this, the more specific pHs of the children, the older people, and then the average adult, that was based on the products, because obviously everyone's using different products, so that the products that each individual was using, how many times that they were washing and cleansing their face, and with what. So the general, whether it's man or woman, whatever, the pH that they were working with became 5.25. So this is why, for those of you who are just washing your face with just water or soap, it's not beneficial, because water typically will be neutral ideally, but most of the time it's actually alkaline depending on where you live, and most soaps are alkaline. So your skin should not be alkaline, it should be slightly acidic. And one of the studies that they showed was the best pH for your skin to be at its best pH to increase efficacy of active ingredients to increase hydration is actually 4.7. So lower pH of the skin actually helps maintain your skin barrier, which over long term helps slow down the crinkling and the wrinkling of the skin. And for those of you who have eczema, fungal acne, or acne, it actually keeps the good bacteria in check and keeps the bad bacteria under control. So when the pH is too high or too low, your skin can become too dry or too oily. And this study also showed that if you have a lower pH on your skin, you are actually more resistant to dermatitis, especially according to this one study, SLS, which is sodium lauryl sulfate, induced dermatitis. So you become more resistant to that. So remember when I said that just a few points in the pH can make a huge difference? Well, this study showed that when the skin is just a little bit lower than 5.0 or at 5.0, it actually showed the skin less scaling and less dry. When they measured it at 5.03, it actually showed that the skin had a higher ability to increase hydration in the skin. So generally speaking, basically when the pH is lowered in the products, it actually increases the efficacy of the product, especially when they're using organic acids such as lactic acid. And they also have shown that when the acidity of a product is lower, it actually keeps it more stable longer, such as sorbic acid or benzoic acid. So what does it mean for Mahmoud and you? Well, so here's the solution that we did for him, and possibly it could be for you. So the first thing we did is he had way too many skincare products, too many variances in pH of skin, back and forth as he used all these different skincare products. So we had to narrow down the products that were actually for him to treat his specific skin conditions that he wanted treated. The other one is you have to use the skincare products in the correct order. And not only that, knowing when to use it. And so given his lifestyle, we had to step away from some of the AHA, especially if he's out in the sun for several hours almost every single day. The other one was he lives in a very dry climate, so we had to adjust the products for that. So for example, he was using cleansing oil. Okay, so first of all, he wasn't overproducing oil, so he didn't have a lot of oil on his face, and he wasn't wearing heavy makeup. So with the cleansing oil, we got rid of it. Then what we did is we actually added more humectants into his skin. And then we had to balance that out because it is dry, we don't want the humectants that he's using pulling it from his skin. So we had to balance that with a cream gel. So not exactly a cream, which was too heavy for him, especially during the summer. We wanted to be somewhere in the middle. We also changed out his cleanser so that it was actually a good pH for his skin type. The other thing that we did is because he's outside a lot, is we wanted to use a sunscreen. So we used a sunscreen that actually was a moisturizer for oily skin. It actually absorbs oil at the same time, and it actually had some natural lighteners and brighteners, tyrosinase inhibitors, to help reduce pigment production. And then the other thing that I had mentioned before is that once the summertime is over, where he is, I asked him to go and get professionally done a series of microdermabrasion, which actually is going to help smooth out the uneven texture brought on by the acne scars that he got from a long time ago. So before I give that pro tip, please go ahead and hit that notification bell and subscribe to our channel if you're finding all this information helpful. And here is the pro tip. So the first one is, make sure that you're using a slightly acidic, it doesn't even have to be super acidic, but a slightly acidic cleanser. So it actually, if your skin is already alkaline because of other products that you're using or the water that you are using, so that when you do actually use more acidic products following it, that your skin stays at a lower pH, it increases efficacy. And then if you are using more than one serum, then make sure you take a look at this video to show you how to layer those different serums. So if you are tired of dancing around from product to product trying to find that magical elixir and getting tired of little to no results, then consider having a licensed professional do your skin analysis and a unique protocol designed for your skin based on your lifestyle, age, and skin condition. But remember, makeup is an art, skincare is a science.